By the next morning, when you come back to the clinic, we always see you at day one for an initial assessment. Your vision is basically very good the next day. So your distance vision is going to be 20/20, very, very close to 20/20. And your near vision will be very close to being able to see iPhone easily by the next day. So the actual aims that we go for, we see the results of very quickly. Next day, you're already seeing what you're getting.
Mm.
What I'm talking about with this kind of brain adapting usually happens over a period of 6 to 12 weeks. And we find during that time, whilst you can still see clearly for driving and you can still read your computer and your iPhone at work, there are periods where your brain might just suddenly go in and out of focus a little bit, your vision, either for distance or for near. And that is just your brain suddenly realizing, hang on a minute, something's happened, right? So that's what we call neuroadaptation, or what we call cross blur, which is when you get these symptoms of a bit of blur. And it's very variable what patients experience. We've done a lot of PRESBYOND now. We find that most patients, for the average, it's about 6 to 12 weeks. During that time, they're back at work. At our practice, we operate on a Friday, so we do a laser list every Friday. And most patients are back at work on Monday. So you can see the recovery is very quick. We do a lot of professionals and a lot of, electricians and people that need to go back to work. They've got their own businesses. They want to go back as soon as possible. So Friday, you're back at work on Monday, but the whole process where I would say your vision is optimized, or, you're getting that final product, is usually about the 3-month mark, where we find that patients come back because we see them 1 day, 1 week, 1 month, 3 months. It's usually the 3 months that they're like, oh, wow, my computer vision's really come into real focus now. So we find it usually is a little bit delayed in that sense. But there's a difference between like the vision that patients achieve and then the kind of blended vision or that optimization. And I would say that's what I'm talking about when I say it takes about 6 to 12 weeks. But they don't walk out the next morning. They're already seeing the targets clearly. It's just that the spherical aberrations, which I mentioned earlier, which is that depth of focus, that takes a little bit of time for your brain and for everything to kind of integrate.
Okay. So, yeah, it's interesting. You mentioned electricians as like one of the, patients, one of the types of patients that maybe this procedure can help. I guess a lot of tradespeople, they're doing lots of close work. So
Yeah.
a procedure like this could
Yeah,
be
we
very
get
helpful.
lots of tradespeople. We got lots of obviously office workers of all sorts. I mean, it's pretty much universal that everyone wants their distance computer and reading vision in this day and age.
Mm.
It doesn't matter what you're doing. You want to be able to see clearly when you're driving, and then you want to be able to look at the dashboard in the car. But then everyone has iPhones now. So I feel like everyone needs that range of vision. So we get kind of patients from all walks of life. Interestingly as well, which we haven't really touched on, is we've been talking about the patient that comes to the clinic who's never had any intervention before, like they're a new patient. But you can also do PRESBYOND. We do PRESBYOND on patients that have previously had LASIK. So, if you had
Okay.
LASIK when you were 25 and now you've got presbyopia, so we can do PRESBYOND on those patients. So we can basically kind of update your old LASIK or update your old refractive surgery. And then, so that's kind of one side. And then the other side is patients that may have had cataract surgery, and they may have had cataract surgery where the lenses were, the prosthetic lenses that were put in only corrected for distance. Then we can do PRESBYOND on the surface of their eye to give them more range of vision. So it's actually not just for those 40, 60-year-olds who have virgin corneas and, virgin eyes that haven't been touched. We can also, there's a cohort of patients that I do PRESBYOND on who have already had pre-existing laser eye surgery. And then there's also some of my 80-year-old patients that have had cataract surgery, but they want a little bit more range of vision because the surgery they had didn't give them quite the range that they wanted. So it does actually cover a bit of a broader kind of area of demographic than we originally discussed.
All right. Well, so you mentioned that the brain, like the patient's brain, has to go through an adjustment process, and I guess most most patients find that's fine. But if there are like cases where people are struggling to adapt, like, do you have any strategies or any follow-up
Yeah.
things that you can do in that case?
Yeah. So I think it's really important to reinforce that because the process for selection is so rigorous, and we actually do a lot of assessments for to check that if we think that they're going to adapt well before the surgery. So we actually turn down quite a few people if we don't think that they're going to adapt. 97% of patients will adapt though. So there's a high adaptation, and it's usually if they've passed what we call the cross blur test, which is one of the assessments we do in our clinic, they're going to adapt with time. It just may mean that instead of falling in that 6 to 12 week zone, they might fall into a 6-month or an 8-month zone. So I remember the gentleman that actually invented PRESBYOND, Professor Dan Reinstein, he lives in London. He had PRESBYOND and he actually took a year to adapt. So there is definitely, I've had patients that have been fine after day one. So for a start, it's really important that there is a range for that. I'm just giving you the average. Secondly, there's no reason that you can't have a temporary pair of glasses prescribed. So that doesn't influence how quickly you will neuroadapt. Okay. So it's usually either going to be that you're having the issue at distance or you're having the issue up close. It's not going to be for both. So if you are finding that you're going to the cinema and the subtitles are going in and out of focus a little bit, you can just get some distance glasses prescribed temporarily. Okay. So that's usually what we would recommend. We keep a really close eye on you. We see you, as I mentioned, I've already touched on the follow-up, but we see you like a lot during the process. So you'll be seeing us regularly. Now, what's the worst case scenario? Say it hits a year and you don't neuroadapt, then you can just reverse the non-dominant eye. So it's really not like, it's not ideal, obviously, but it's something that can be reversed. So you can basically retreat the eye that was your near eye and you can make it for distance, and that will still leave you with good distance vision and good computer vision. So what you'll be missing out on is that kind of close-up iPhone vision. So that would be absolute worst case scenario. We've never had to do that. I think that would be exceedingly rare, but it is good for people to know that there is an option, if it were to come to that.